I am Sharon Kordasti, hemato-oncologist from King's College London. This year was an exciting year for the field of bone marrow failure syndromes, the non-malignant, and there are a few very interesting talks and discussion about what exactly lead to bone marrow failure, the immune side of the bone marrow failure, what exactly we mean by immune dysregulation in these syndromes and in group of diseases, bone marrow failure syndromes. And also the other aspect is, are we really talking about purely non-malignant, or there are some overlap with the malignant types, and how we can recognize that, how it affects our approach in those overlaps, and how we can have a better insight and better understanding of pathophysiology by looking in these overlaps. And the other aspect was novel therapies. There were a few very interesting talks on novel treatments. There were a few very interesting talks about the clinical trials that are ongoing, clinical trials that published, and clinical trials and the potential future clinical trials, which includes, for instance, cellular therapy, a kind of cells like regulatory T cells, which is very new and novel because regulatory T cell therapies are quite new compared to other therapies like CAR T cells, and therefore we are still learning lessons, and that was very interesting to discuss further about the findings so far and future. The other aspect was using specific drugs for controlling dysregulated immune response in these patients, which haven't used as such before, like JAK inhibitors, that trial from NIH, which basically presented an ongoing plan for this trial. And the other aspect about the overlap between the malignant and non-malignant bone marrow failure is the presence of CHIP, and how clonal hematopoiesis may affect these patients, both in terms of treatment and longer-term outcome. We had a very long discussion and very fruitful discussion about how this might affect outcome of treatment and longer-term transformation potential, is it happen or not in these patients. Overall, we have several sessions, very interesting, very fruitful discussions, very exciting data. And I think in next few years, we should expect much more data coming out with far more detailed information about not only the non-malignant, also the overlap between malignant and non-malignant bone marrow failure. Thank you.